Harvard School of Dental Medicine, and Dr. Leonard Brennan. Thank you so much for being with us
It's a
today.
pleasure to be here.
Dentistry, going to a dentist's office is something our mothers dragged us to. It's not a terrible experience, though, is it?
No, it doesn't have to be a terrible experience. It should be a learning experience. And what's interesting over the course of my career, over the course of 30 years, prevention is working. So when children came into the dental office 30 years ago, the decay rate was very, very high. And what has been wonderful to see over the course of a career is to see the decay rate for young children drop to a remarkably low level. Unfortunately, the decay rate for our senior population hasn't had that same luxury. So one of my goals over the last 30 years was to take some of the prevention methods that work so well for children and implement them in adults. And they work as well, if not better, so that the experience when you're 85 can be quite pleasurable.
And with the rising number of older adults, that marketplace for dentists is something that is important to address, isn't it?
Yes, the dentists, with the population increasing and the dental population really staying the same, there will be a shortage of dentists for the population. So it's important for the dental community and for patients to be thinking, how do I maintain a healthy lifestyle preventatively, cheaper, and I can maintain my teeth longer? And the educational part is more than just educating patients, but family members and physicians, so that the community works as a team to help maintain healthy teeth for a community, for the senior population.
Our teeth really reach far beyond our mouth, don't they? They really have an impact on the rest of our body. Talk a little bit about that for us.
Well, we tend to think of teeth locally. So if you have an issue with your teeth, you may get gum disease or you may get a cavity. But we need to think more universally. Now, when you look at the teeth and you see the cause of the bacteria that causes the disease, it's influenced by a lot of different factors. The fact is that the bacteria that can cause these diseases, it's being shown in studies, will not only affect teeth and gum, but can affect distant organs, vasculature, heart tissues. It can influence diabetes and arthritis. And many of the diseases that are common in the elderly, there can be a direct effect. So when we think, part of our mission is to have people think more universally and not locally. We are our teeth, from head to toe. So it's hard to segment that part of us and say, dentists deal only with the oral cavity. The oral cavity is as much a part of us as the rest of us, and which is why I think you're hearing a lot today about we want the medical community to be part of what we do, and they need to be educated on a comfort level that they can go in and take a look at the oral cavity and feel some comfort in at least what pathology is, so they can be used as a referral basis. Dentistry today has come a really long way in being physicians of the mouth. Dr. Swan is a wonderful teacher at Harvard, and he makes a point that we have been trained to diagnose, take good histories, and to be a referral basis for physicians. And so it's very important for the physicians also to partner back so that they can detect lesions or pathology so that they can be referred back to the dentist. Because their treatment in terms of how do you make a healthy patient is more than just exercise, and it's more than just diet, and it's more than just a surgical or a procedure. If you want your patient to eat, they need to have a healthy oral environment. It's connected.
You make so many good points right there that when I go into a doctor's office because something aches me or I've fallen, it could be leading back to a dental problem, couldn't it?
Yes.